Now with our cover story and a GMA exclusive, a big announcement from Eli Lilly this morning. Their popular obesity drug Zepbound will now be available for purchase on their direct-to-consumer platform. The company hoping to curb fakes on the black market and make the medication more affordable. I sat down with the Eli Lilly CEO, Dave Ricks.
This morning, pharmaceutical giant Eli Lilly unveiling a new version of its weight loss medication, Zepbound, to sell directly to consumers.
It's an exciting day for people who've been looking for a way to access and afford our weight loss medication, Zepbound. Now they can go to Lilly Direct and with a prescription from their doctor and a phone, access the drug in a vial form.
In an exclusive interview, CEO Dave Ricks saying this plan will make the drug more available and affordable, allowing people to purchase it without insurance.
We're working to build more supply, but in the meantime, we can now release these vial forms that are of both our 2.5 and 5 milligram dose that are going to be more available and at a lower price, about half the price of our auto-injector form and those of the competitor products. This is launching at $349 for the low dose and $549 for the high dose. And that's a significant discount.
And is that enough? You mean for like a monthly amount?
For a monthly amount,
okay.
Yeah. Exactly.
I mean, that's still a lot of money.
It is a lot of money.
People still would be paying a lot. I mean, that's like a car payment for some people. Can you explain why the cost is still so high?
Well, we're, of course, researching and developing medications. We invented this product. That's an expensive undertaking. We're studying it in over 30 different conditions to prove not only do you lose weight, which we've proven, but that benefits your health long term. That's incredibly expensive as well. The key point is that the other medications of the class cost about $1,000 a month, and here we're bringing that down by about half. I think that's a big advance.
Ricks explaining how the vials work.
Show us the difference so that people can understand.
Yeah, so this is our auto-injector, which is the normal Zepbound people may use today. The complexity of manufacturing is very high. And so this is one of the constraints as to why we couldn't make more, and sometimes we've had some shortages. We're introducing the vial, which is comes in a box like this, but will look like this. It's a very small vial, and it'll ship with a needle if you need that. And people will draw it up and self-inject. The medicine will work identically, but the injection experience has a few more steps.
As the drug grows in popularity, questions still remain about the costs, the limited supply, and exactly who should be taking these medicines.
This drug was approved for people with type 2 diabetes, but we know that some folks are out there trying to use it to lose a few pounds. It's like a running joke in Hollywood. Do you have any concern that making it more accessible then creates the situation where you have more people getting to the drug who are using it in the wrong way?
We do have that concern, and we've been pretty vocal about that. That Mounjaro is the diabetes drug. Zepbound, what we're talking about today, is the weight loss or obesity drug. It's for people with the medical condition of excess body weight or obesity, not for people who don't have such a condition. And especially in a time of a shortage where we're struggling to keep up with demand, it's especially important that we channel these medicines to those who need them most. And here today, again, we're offering it in a new channel that lowers the price and hopefully can allow people who need it to access it.
Now, this new version of Zepbound in the vials is available starting today. Eli Lilly is one of several companies also working on a pill form of the drug, which of course would cut costs dramatically even more in the future. But as with all medications, there could be a number of side effects and still a lot we don't know about the long-term use. So for those who are considering this, you have to make sure, guys, that you talk to your doctor.
Right, still a lot of questions out there, but 50% down, I mean, that's huge.
Absolutely, especially since a lot of insurance companies won't cover it.
Yeah,
so it is a medication that people really do need, and this is another way that they can access it.
But that vial will change things in terms of actually getting the medication into you.
Absolutely.
All right.